All right, well then let me read about aortic dissections in a really nice, happy non-war pathway. All right, aortic dissection. What is an aortic dissection? So that's a pretty serious condition that obviously affects the aorta. It can affect it anywhere. It doesn't have to start at the root. It doesn't have to start in the abdomen. It can literally start anywhere. I know somebody who had it start in the thoracic descending, and then 10 years later got one in the ascending. So it really can happen anywhere. All right, so we already know about the aorta. The main vessel supplies all the blood and the oxygenated rich blood everywhere, blah, blah, blah. Okay, so again, here's your aorta. This is all the different places where it feeds blood to. So an aortic dissection is actually a tear. It is not a rupture. They are two different things. A dissection would be a tear that occurs in one or more layers, but not all three. So it's usually in one, it's either in the intima or the media, but it does not occur in the adventitia. I said that right? Because if that would occur, well, now we're pretty much at a rupture. So a tear would be the first layer or the second layer. So a dissection involves a tear in the inner, and then the blood travels in the middle layer and is held outside by the adventitia. Okay, so the diagram below will actually show the three layers in cross section and a representative illustration of what occurs when the blood seeps through. Okay, so this is your normal aorta with your three layers intact. And this would be what happens when you have a tear in the wall. So this is a dissection. Your blood's flowing and oh, it has a little rip. So here it is traveling through the middle layer. This is what it looks like on this side view as well. So it's traveling and there's a little tear right here and then it starts going into this non-existent place right here. Same thing here, tear in the aortic wall, looking at from another angle, okay? So it actually can disrupt blood flow to your brain, to your limbs, to your organs, to any part of the entire body. The initial tear in the inner layer can occur from anywhere, just above the heart, which would be your aortic root area, and along the entire aorta, anywhere on its way down. Okay, so a type A would be anything that's on the ascending, type A ascending. I like the way that Dr. Udelman says that. So if it's in the first part of the aorta, near where it exits the heart, or in the arch, it's ascending, okay? If it's ascending instead of descending, it would be the letter B, ascending, descending, B. So if it's in the descending part of the aorta, beyond where the artery that goes down the left arm branches off, which we saw that left subclavian, we saw those three different branches, that would be called a type B dissection. Okay, there's different various risk factors for an aortic dissection, including your general health risk factors, your genetic risk factors. Obviously, if you have an aneurysm, high blood pressure, bicuspid aortic valve, illicit drug use, atherosclerosis, cocaine, weightlifting, other sports activities, high intensity, contact sports, pregnancy, genetic factors like a connective tissue disorder such as Marfan or Lowy Dietz, Ehlers-Danlos, if you have a genetic condition, chromosomal like Turner, bicuspid aortic valve syndrome. All of these things could be a reason for concern that can cause a dissection. Everybody wants to know, what's a dissection feel like? How will I know? And the best thing I can say is you're just going to know when you know your body. If someone tells you when you feel a ripping, tearing sensation, that's it. That's a dissection. Well, that is true. But there are a lot of people in the community that have felt nothing. They just feel a little dizzy, a little off. Some feel like they have gas or reflux, and that's just about it. So it varies on the pain scale. So the best advice I can say is if you feel like something's wrong, it's always okay to get something checked out, is my point. So if you're like, I don't know what this is, contact your doctor. They'll tell you what their rule of thumb is. I've spoken with my doctor, and sometimes it's see if you can shift position. If it is gas, get the gas moving, get it to come out and up. If you change positions, does the discomfort change? If that's the case, that's a good thing. Okay. If things stay the same and they're not moving, my personal physician has told me and me alone that that's when I might want to go in and get it checked out. It has little to do with what my blood pressure is reading or anything like that. I can't really define what the pain is going to look like, but in most cases, it's pretty sudden and intense, and the pain can occur anywhere in the chest, up towards the head, the neck. It can be in the jaw, back down and into the abdomen. It can be in your arms. It can be in your legs. It really depends on what portion of the aorta is actually involved. Other signs and symptoms definitely could be if you lost consciousness, if you were finding difficulty walking, if you had weak pulses in your hands or feet. Also, if you had a significant difference in blood pressure between your arms or if you had to take it around your ankles. That's a pretty telltale sign that there's been a dissection. Or if you, for a brief period of time, feel nothing, no sensation at all, like you are completely numb. And I don't mean pins and needles, I mean nerve block numb. If you just can't feel a limb, that's a pretty clear sign as well that you need to get it checked out. So it's a medical emergency. This isn't one that you're going to sit and wait in the waiting room. You're going to tell triage, I have an aneurysm or I have a family history of aortic issues and dissections, and I believe I'm having a dissection. I need to be seen now. I'd like to say in all cases, it's going to get you right back. It might not necessarily happen, especially if you don't have a known connective tissue disorder, but that's your best chance at getting right back. In these days and times, it's not even a guarantee if you take an ambulance ride that you're going straight back. I have seen and heard of people that pick people up in the ambulance, and if they're not 100% sure in that ride, they will put you in a chair in the waiting room with everybody else, and you will wait. So, yeah. Know your family history, know what you're feeling, and share it. And if you need somebody to advocate for you, make sure that they're aware as well. Complications to an aortic dissection can be severe. It really, really depends. It doesn't always happen to everybody. I have no percentages on that, but it goes from anything as the worst possible, which would be sudden death, to internal bleeding. You can have organ damage. You can have kidney failure. It's pretty common amongst some people that have this complication. Intestinal damage, aortic valve damage is more common than not, whether it's regurgitation. You can have rupture into the tissue that surrounds the heart. That would be cardiac tamponade. People have had strokes. People have lost limbs or toes or fingers, malperfusion, just not getting blood to the right areas that they need it to go to. So those would be the major complications that happen. I can't, again, when I think about just if I had to take a poll of the community, I don't know that it happens more often than not. I don't know what your thoughts would be, Molly, but I don't even have like it would be 50-50. I really just don't know because I don't know that everybody talks about those complications. And it doesn't necessarily happen in that moment. It could happen when you're in the hospital for a couple days later. So do you have thoughts about that?
No, I think everyone's different, really.
Yeah.
I mean, I found that I had some I want to say heart damage. I don't know. It's something I really need to directly ask my cardiologist. But there were my heart was messing up a little bit when it wasn't prior to the dissection. But yeah, I think everyone's different, and they could come about usually on the onset of the dissection. It seems they could come about as time goes on too. I don't know. Everyone's.
Yeah, it's all different. Yeah. But if you have our book or when you download the book, if you want to learn a little bit more information about this, you're going to find that on pages 13 through 25 is where you can find this information about dissections. It's interesting. Doesn't happen to everybody. See, this is why we want to know about your family medical history to determine who's at risk, to do diagnostic testing and decide if you need to be monitored. Dissections are rare. But aortic disease and aortic aneurysms they're a lot more common than anybody realize, and so that's why we have these conversations all the time.
I recently watched Jack Crow's spectacular Survivor series, and very well said. And what a man! He later found out after his dissection, he's one of six kids, and I believe they're all boys. But I believe there are 3 others that have. One passed away suddenly of a heart attack. There was an aneurysm. There was another possible dissection. Anyway, 3 or 4 of the boys in that family all had this disease.
Isn't that amazing?
I know.
It's amazing.
He didn't know. They didn't know.
But yeah, it's crazy.
Think aorta, think family.
Absolutely. Hashtag.
I recall someone else telling a story where it may have been Dr. Udelman, where they would not release or discharge an aortic dissection patient until his children were scanned. So they
Yeah,
actually,
I asked him about that, and he says legally nobody can hold a patient and force other people, but he said they are more often than not talking to family members to explain you really need to make an appointment. Like make
amazing.
the appointment, understand and know this.
Yeah.
And they don't want to release until they've had the conversation and educated is definitely what it is. But obviously can't hold somebody, but yeah, it is happening more often than not that they're going to bring the family members in and just say, this is really important now that you know this, and you need to you need to consider to have yourself checked. And there are still family members out there that don't want to know.
Yeah. And that's their choice.
Yeah, it is scary.
Choice.
Scary.
But I think that the siblings or children, grown children, can certainly go into a doctor's office and my brother, my mother had an aortic dissection, and they would be fast tracked right into that CT. I guarantee
Oh
it.
yeah. Absolutely. And insurance would cover it.
Yes.
And you could also have genetic testing through clinical for sure. They definitely would test the person who had the dissection. Research studies will not test you unless they found something in the person who had the dissection. So yeah, they operate a little bit differently, the research versus clinical. But yeah, you'd be fast tracked for that as well. Yep.